I'm Gray Krause. I'm Professor Emeritus of Biology and Director of the Emeritus College, and I'm very pleased to welcome you today to one of our retirement seminars. We have several of our members here today who are going to help tell you about some of our activities and to provide any commentary they would like at any point. Those are Helen O'Shea, who's Professor Emerita of Nursing, and she's going to be talking about a retirement mentoring program. And then Gretchen Schultz, who's Professor Emerita of English from Oxford College, Ron Gould, Goodrich C. White Professor Emeritus of Mathematics, and Jim Keller, Professor Emeritus of Radiation Oncology. And so I thank those members for being here as well today. So for our program today, I'm going to start by giving an overview of healthcare choices that you will have to make when you retire. And then Helen O'Shea will talk about our retirement mentoring program. And then after that point, we'll have a more unstructured part of the program in which our members can mention any parts of the Emeritus College they would like, and you're welcome to ask any questions you might have about the Emeritus College, about retirement more generally. So now the situation for health insurance for those who are 65 and older is that Medicare will be your primary insurance. However, Medicare, which includes Part A and Part B, by itself is not sufficient coverage. And so you will all want then to get one of two basic forms of supplemental health insurance, either a Medigap plan or a Medicare Advantage plan. Now, those plans are sold by insurance companies who make money by selling them. And so once you turn 65, you will get lots of mail from companies and from these plans trying to sell you many different plans of coverage. Their main concern, of course, is making money and not necessarily what is best for you. But you probably, those of you who are already 65 and older, have probably been getting mail like that. And so there's lots of interest in selling you these plans. Now, there are two companies I want to mention. One is Via Benefits, and you probably will start hearing from Via Benefits even before you retire. And Emory HR has contracted with Via Benefits to help retiring employees choose a healthcare plan. HR is in a difficult situation in that choosing a plan is very complex. And so for HR to have enough trained people to help retirees make those choices would be very expensive. And so by using a firm like Via Benefits, they can offload that information to Via Benefits, who can then meet with employees. And it's free for employees, and Via Benefits clearly makes money by selling these plans. So the companies basically pay Via Benefits for selling their policies. Via Benefits does not offer all available plans, and so there are cases in which they don't offer plans because the plans are really not very good. There are also cases in which they don't offer plans because they don't get any commission from selling those plans. One thing to understand is that you don't have to get any plans through Via Benefits. You can contract directly with the companies without going through Via Benefits. I will say that many of our members have expressed the fact that they have found it much easier and more pleasant to deal with individual companies than going through Via Benefits. Via Benefits, though, is an option. To make things more complicated, Emory Healthcare has contracted with another company, Medicare Compare USA, to provide help to Emory Healthcare patients in choosing a Medicare plan. Again, that is free, and Medicare Compare USA makes its money by selling plans as well. I think that Medicare Compare USA has been at least a little bit more careful about trying to avoid confusion by sending information to Emory employees who would be retiring, because then one sees competing information from Via Benefits and from Medicare Compare USA, and that is not helpful. I will also say honestly that a number of us who have looked at the information from Medicare Compare USA, that it seems to be very biased towards Medicare Advantage plans. Our feeling is that that is not to the advantage of potential insurees. Now, here are the basic differences between Medigap plans and Medicare Advantage plans. Medigap plans are accepted by any provider that takes Medicare. Those plans do require a separate Part D drug plan. The confusion is that there are a lot of companies, probably something like 30 in Georgia, offering Medigap plans, and the plans can include plans A, B, C, D, F, G, K, L, M, and N. So you can see the potential level of complexity with lots of companies and lots of plans, though most companies offer only a small subset of those plans. Now, the interesting thing is, by law, any plan X, A or plan D or whatever, must be the same no matter what company uses it. So that's an important consideration, that your choice of, but no matter what company you go through, they should offer the same coverage for any of those particular plans. Medigap plans have some coverage for foreign travel. Now, Medicare Advantage is quite different, and are certainly some potential issues. So unlike Medigap plans, Medicare Advantage plans only use a network. And so if you have a particular Medicare Advantage plan, you have to worry about what providers are in network and out of network. That has been a perennial issue with Medicare Advantage plans. Medicare Advantage plans usually will have a drug plan, but that can be a plus or minus because every plan has a formulary. And so it depends on what the formulary is as to what the charge is going to be for drugs. Now, Medicare Advantage plans will generally be lower in cost than Medigap plans if you don't have much healthcare services that you need. Now, that of course is an issue that if one is on very limited income, Medicare Advantage plans can be appealing because the initial costs are low, but one can end up paying much more through Medicare Advantage plans and Medigap plans if you have a lot of healthcare needs. There's usually no coverage in foreign countries for Medicare Advantage plans. So another thing that is very important to understand is that in general, it's difficult to switch plans after making an initial choice. When you first become eligible to get a Medigap or Medicare Advantage plan, you cannot be denied on any basis. However, if you switch later, you can be denied or you can be charged higher premiums. So for example, you can't decide, well, I'll get a relatively slim Medigap plan, and then as I get older and need more coverage, I'll just choose a better and better plan. That doesn't work. So it's important to choose the type of plan you want initially and the company upon first enrollment, because you can't easily or cheaply make changes after that in first enrollment. The other thing to note is that for either type of plan, a plan is per person and not per family. So if there's you and a partner or spouse, you will each have to choose a plan. And I should say, by the way, that if you have any questions while I'm talking, go ahead and click on the raise hand, because I'm trying to monitor that as well as I'm talking. So if there's a question that comes up, you can ask now or wait till the end, and I'll be glad to answer any questions that you might have. So our bottom line advice is that unless your finances are extremely tight, a Medigap plan is preferable. And that is, I think, quite robust opinion, that it's, we feel very comfortable in making that. Now, most of our members, I think, have a Medigap Plan F, which is the richest plan. That is, that most expenses are covered. And so, of course, the premiums are more, but then what you get is more. Now, the issue is that Medigap Plan C and F will be phased out in 2020. Now, that has an asterisk, because if a person would have been eligible for a Plan F when they reached 65, but retire after that point, they could still choose a Plan F. So if you are just retiring and turning 65, you would no longer be eligible to choose a Plan F. But if you retire at a later age, you could still choose a Plan F. So that becomes still an option. And we'll get back to that in a minute. So here is just a chart showing the various Medigap plans that are still available and what percent of charges they choose for everything. And you can see it looks very complex. However, plans F and plans G are the most comprehensive. And you can see that they only differ by one thing, which is paying the Part B deductible. Otherwise, they're the same. And otherwise, they pay as much or more than any other choice of plans. Okay, then another question is when you should apply for each part of Medicare. And in the past, HR has been recommending that employees go ahead and apply for Medicare Part A when they turn 65. However, the official Medicare guidance has this special enrollment period, and I provide the text here. It's also in the newsletter. You don't have to read all that. The bottom line is you can enroll in Medicare A anytime past age 65, as long as you are still covered in an employee group plan. So that is, if you are still employed at Emory and you're past 65, you don't have to worry about applying for Medicare Part A until you retire, as long as you stay on the Emory plan. Now, applying for Medicare Part B and a Medigap or Medicare Advantage plan, here again is the official verbiage. Again, that's provided in newsletter. You don't have to worry about reading that. The bottom line is that if you're retiring past age 65, you want to roll in Medicare Part B and arrange for a Medigap policy to begin effective on your retirement date. So this is something that you would want to start doing a few months before your actual retirement, but you don't have to worry about it until you retire, as long as if you're past age 65. And if you have a spouse who is also in the Emory plan, that applies to them as well, that they can stay on your Emory plan as long as you're employed at Emory, but once you retire, then and your spouse has been on your Emory plan, both of you will need to enroll in Medicare Part B and get a Medigap plan. Now, the cost for Medigap plans vary. Some companies, such as USAA, do not pay a commission to sellers, and so they're generally offered only directly to consumers, but they tend to be less expensive. And so Via Benefits, for example, does not offer USAA plans. The reason I mention USAA particularly here is because they have a great reputation as an insurer, and many of our members have gotten their Plan F through USAA, and they went directly to USAA to get those plans. Now, if Plan F is no longer going to be offered to new enrollees after 2020, with that exception that I mentioned, what plan will replace it? So Plan G is identical to Plan F, except it doesn't pay the Medicare deductible. Now, the reason that Plan F is being eliminated is that Congress mandated its elimination because they wanted consumers to have more skin in the game, that is, to pay some of their expenses. Well, what is the Medicare deductible? This year, it's $198 for the year. So therefore, one might expect that the premium differences between Plan F and Plan G would be a total of $198 for the year. That's not the case. And this chart shows some companies that are selling in Georgia and in our zip code, and the charges that they have. Now, there's several things that one might find peculiar. Is that in general, when you are looking at you're trying to find rates for Medigap insurance, you're asked to provide not just your state, but your zip code. And that zip code can make a difference about the charges that you will see. So in fact, these companies will offer policies in some zip codes and not others, certainly in some states and not others. And charges in general will depend on the age at which you first apply for a Medigap plan. Now, in Georgia, essentially all plans are issue age rated. That is, the amount you pay is dependent on your age at which you get the policy. However, after that, the increase is not based on your age, but just a general increase. So the increases after your first year should be in line percentage-wise with percentages for other people of other ages in those plans. Now, this shows that for a variety of companies, these are monthly premiums for a male non-smoker, and all those things can also have a benefit, who would apply at 65 or at age 70. And there's some other years illustrated in our newsletter as well. And these are monthly premiums. And so you see that there can be actually substantially large differences between Plan F and Plan G on a yearly basis. Now, these do not include the Medicare deductible, but still with a Medicare deductible of $198, you can see that Plan G is actually considerably less expensive than a Plan F. And you can see that also there are differences. Now, USAA is unique among offerings in Georgia in that it's a uni-age issue. That is, the amount you pay is the same no matter what your age is when you get the policy. And so certainly at young ages, USAA is not very competitive. They are more competitive at older ages. So if you look, and so the question is, why should Plan G be less expensive than Plan F? I think the likely explanation is that there are different insured populations. That is, Plan G has perhaps become more popular later on, and so the population in Plan G is relatively younger and relatively less sick. So the cost will be different than in Plan F. It's not clear. That's only a speculation. Then the question is, well, when you see this, why would you not choose a Plan G that is the least expensive? Why would you want to pay any more? Because every Plan G has to cover the same thing. The trick is, of course, that the cost of a plan is going to be determined by the cost that a company incurs for that population of people in that location. If a company has priced a plan attractively and finds out it was too low, you could have substantial increases in later years and very little option because you can't easily change to a different company. And for example, AARP has just started offering a Plan G in Georgia. And so you can see that the AARP, the price is actually quite attractive. The question becomes, have they priced it appropriately? Does their population look like? And are they going to maintain that pricing later on? And it's difficult to say. USAA is a somewhat peculiar situation in that if you go on the USAA website and look at the plans they offer in Georgia, a Plan G is not even available on their website. However, if you call them up, you find that they actually do sell a Plan G in Georgia, but they don't advertise it. So that's a little bit disconcerting. And so I'm not clear what to say about that, but it's the choice of a plan is, I think, less obvious than it used to be. I think my own recommendation is leaning towards a Plan G rather than a Plan F. One possible problem is that since Plan Fs are no longer being sold to young people, the population of insured in Plan F is going to gradually get older and therefore likely sicker, and that could lead to higher premiums. I was talking with a representative of USAA, and they didn't think in the coming years that was going to make a substantial difference in their premiums, and they mentioned some other plans that had been discontinued in the past. But that illustrates some of the complexity of trying to choose one of these plans. You will also need to get a Medicare Part D drug plan, and that choice is completely independent of a Medigap plan. Now, there are several differences. Whereas you cannot easily change a Medigap plan, you can easily change a Part D drug plan every year. And so if you want to, you can go with a different company every year. And one of the things you would want to do is actually check every year to see if there's a better plan available. Even if you are not using many drugs at all when you retire, if you don't choose a Part D drug plan, there will be a penalty imposed forever on you if you fail to purchase a plan initially. So you'll want to get some plan, probably the cheapest plan possible, rather than not getting a plan because you'll pay a penalty later on. Part D plans are really very complex. And so there's a lot more information in our newsletter. Unfortunately, it is very difficult to try to say what plan is going to be better. Certainly, if you know what drugs you take, you can put them into a web page on the Medicare site and see what your cost would be in various plans and choose a plan then that would be the least expensive for the drugs you take. If you think about it, however, if you need to start taking new drugs during the year you're insured, you can't know that you have made the best choice for those. So anyway, it's complex. Our newsletter provides some help. Unfortunately, it's one of those things that is just an indication of how our healthcare system needs to be reformed. Now, I mentioned the Emory Subsidy. That's those hired before 2003 and who've maintained Emory healthcare coverage until retirement. Now, this includes a spouse or partner as well. So if both you and your spouse have been on the Emory plan through your time here, then when you retire, you will get $128.68 to help you pay for healthcare costs, and your spouse will get the same amount. That's per person per month. That subsidy is obtained through VIA benefits, but you don't have to buy any policy through VIA benefits. You do have to register with VIA benefits so that you can get that subsidy amount, but that's the only contact that you have to have with VIA benefit. The other thing about the subsidy, which affects only a few people, but is a great advantage, is catastrophic drug coverage. So under Medicare Part D, once your out-of-pocket drug costs have come to $6,350 a year, you go into catastrophic drug coverage in which 95% of all your drug costs will be paid. Now, that sounds good unless your drugs are enormously expensive. And there are some cases in which that's true. What Emory does is pay for all costs after that amount. So that is a huge benefit for a very small number of people. So at this point, I'm going to stop, and I'll be glad to answer any questions that any of you might have. And if I can't answer it, I'll turn them over to Jim and let him answer them. So just click on raise hand. And okay, so there's one question that came through chat, and it's a great question, and says, if plans are location specific, what if one does not expect to stay in Georgia after retirement? And so what I think the answer is, and then I'll let Jim correct me or add anything he knows, because I'm not completely sure of this answer. If you're going to retire and stay in the Atlanta area for a while, you can go ahead and get a policy here. Medicare does have one of these exceptions that if you move more than X number of miles to someplace else, then you have another period in which you can enroll without penalty. And so you could enroll in another plan at that point, I think. But Jim, what do you have anything to add to that?
No, other than the fact that sometimes the Medicare Advantage plans are in network. So if you're in a network such as Kaiser, for example, you would be covered in all the states that Kaiser is covered by. But if you were in another state that Kaiser wasn't covered by, you wouldn't be. So a Medigap would be preferable for people that are thinking that they may be moving and don't know exactly where they're moving. But if they know where they're moving and they've been in a Medicare Advantage plan and that has worked for them, they could stay in it. But in general, I think Medigap plans are more transportable.
Okay.
I'll stop there, Gray.
Okay, thank you, Jim. Are there other questions that people have? Just click on raise hand and feel free to ask. Okay, if you think of a question later, we can, there's one here. Daryl.
Yep. How do you sign up for the newsletter?
So to sign up for the newsletter, you just send an email to me and say you want to get the healthcare newsletter. That's all you have to do, and I'll be glad to send it out.
Thanks.
Any other questions? Let's see, there's a chat here. Oh, so there's a question, how do you get drug? I think it's, how do you get the catastrophic coverage, I think is the question. And that catastrophic coverage is automatic. If you were hired before 2003 and you qualify for the subsidy of, then that also includes the catastrophic drug and coverage. And then I think probably via benefits would be the one that would make sure that you get that. So you don't have to particularly enroll in it. It comes as part of that benefit package. And then let's see, Bill Woods here, I think, has a question.
Yes, hi. Would you please send your email address?
Oh, so it's gcrouse, G-C-R-O-U-S-E at emory.edu. And
Okay.
I'm going to send an email to everyone who's been here, just giving you several options, but that's all you have to do to let me know. And
Thank you.
Daryl, do you have another question?
Yes. So let's see. Oh, yes. How do you access your PowerPoint? Is it accessible?
I mean, I don't mind sending it out. The newsletter has everything I've said plus a lot more. So
Okay.
there's really nothing in the PowerPoint that's not in the newsletter, and the newsletter has lots more information. If for some reason you wanted, I would send it out to you. But
Okay.
Vladimir.
Just a quick question. Who qualifies for the subsidy and the catastrophic plan? You said the catastrophic is if you get a subsidy, it automatically goes into the subsidy.
Right. So the subsidy, if you were hired before 2003, and if you were on the Emory healthcare plan and you stayed on the Emory healthcare plan until you retire, then you qualify for the subsidy.
Okay, thank you.
Any other questions? And if you think of something later on, we can certainly come back to this.
Great. May I ask one? I'm sorry, I couldn't figure out how to raise my hand. My question is, and I don't know that anybody can answer it, is given that the university is about to go into a very significant economic problem, what perceived threat do you feel to these kinds of benefits for us in the Emeritus College?
So that's a very appropriate question, because certainly the university is facing enormous economic consequences. What I can say, in looking at the list of benefits to employees, I think the benefits that are now available for those retiring are relatively secure. I don't want to go into all the details of how the subsidy came about, but basically Emory set aside a pot of money to fund the subsidy for those employees who were employed before 2003. So that subsidy comes out of those funds that were set aside. So it is not an expense that's coming out of any other pot of money. And what I would say would be the potential risk of that subsidy is that subsidy presumably is part of the endowment in some way or another, and so depends on income coming from various investments in that trust fund. And if the stock market, I would say more likely when the stock market really crashes, that is going to affect the payout of those funds. Usually the university does a several year rolling average in taking funds out. So there might be some effect on the amount of the subsidy, but no one has said anything about that. But what I would say is that the subsidy itself is not at risk. The amount would only be at risk if the funds funding it were substantially reduced. That's the best.
Very helpful. Thank you very much.
Okay, I don't see any others. So if there are questions later, we can certainly come back to it. But now what I want to do is turn things over to Helen O'Shea. She is the chair of a retirement mentoring committee. And so that's one, I think, of the greatest potential benefits we offer to faculty who are thinking about retiring. And so I'll let her describe that program.
Hey, good to see everybody here on a rainy afternoon. Why did we decide that pre-retirement mentoring was would be a good idea at all? Well, it was a matter of those of us who are already retired recognizing that as you consider retirement, you may well be worried about how you're going to cope when you leave what for most of you, or many of you at least, has been your life's work, the way you identify yourself and the way others identify you. So the statement that is in your head that you're a little afraid to say is, I don't know what I'm going to do all day. We believe that pre-retirement mentoring can help you answer that question. And we do it by one-on-one confidential conversations with a peer who has been through the process of taking the leap from the known to the unknown and enjoys being retired. And maybe that interaction can help you realize that there may indeed be life after retirement. So that when you're thinking about, am I ready to retire? Do I want to do, is this really what I want to do? And some of the things that make you wonder whether this is a good idea is that if you don't retire, to some extent, what your life will be like, or at least you did before COVID-19. We're going to ignore that. If you don't, you know that you would be teaching, mentoring students, mentoring peers, doing committee work, faculty and committee meetings, annual evaluations. These are not all attractive options. Writing for publication and writing grant applications. You'd have a predictable schedule because there are semesters and academic breaks. You get a monthly paycheck, which is nice. You got health insurance, and you're probably making monthly retirement contributions, yours and the university's. So when you think about retirement, you can only guess or project what your life might be like. You know what you're retiring from, but have you thought about what you're retiring to? What will I do all day may be a serious concern. Who will I be is another serious concern. Ideally, we would like the potential retiree to be able to say with conviction, the job is what I do, it is not who I am. Through retirement mentoring, we really do think that we can help colleagues who are considering retirement to explore a future in which you have choices and options that you may never have considered. Some of the things that your mentor can help you think through is, and sometimes, this is a bigger worry than one might think, the idea of having to clean out and vacate an office that you had for eons. What do I do with all those books? What do I do with the notes? It's doable. It's doable. I taught full-time for 33 years and I was able to clear out an office. So you can do it. What would you do if you think about the times you said, if I had time, I would? For example, travel. But in this case, you can travel, after COVID is taken care of, when you want to, where you want to, on your own terms. You can read what you want to read and whenever you want to read it, because it's not dependent on an assignment you're giving someone else that you're going to have to respond to. You can learn a new skill. Maybe you want to learn to play a musical instrument or try your hand at art or woodworking, cooking, gardening, golf, learning a new language. there would be time for that if you weren't every day in the classroom, in the office, listening to other people. Another thing is that when you're retired, you can be in charge of how you spend your time. You can read the morning paper in the morning if you want to. You can take time to take care of yourself. And, you know, taking time for yourself is not selfish, it's necessary. You'll need to think about who's going to be in your social network and part of your emotional safety net. These are things that your mentor can help you sort through. And you may also think, but okay, you know, I'm ready to retire. Do I want to downsize? That's a biggie. And again, it's not one to be done quickly. Should you move? That's one we really strongly advise you to not make that decision before you retire, unless you absolutely have been making plans for a while and know exactly why you're moving and to where. The process we use is that all of the mentors are retired faculty and they volunteered to serve. They've undergone a structured training session conducted by the Faculty Staff Assistance Program and the Retirement Committee. And this is how it works. We pair mentors with a mentee. You would be a mentee. I don't have another word for it. I wish I did because it kind of trips over the tongue. What I did initially was to send each of the mentors a questionnaire. Had 3 questions. What is your academic department and specialty? What interests and activities do you enjoy? And what do you do in your spare time? And I also said, if you take more than 5 minutes to answer this email, you're overthinking it. So they sent their replies and I compiled them. And then I sent them to each member of the mentoring committee so that they had information on each of the mentors. So when a request comes in to say, hey, you know, I think I would like to have a mentor to help ease the process. You sent that to the Emeritus College and then Diane sends it to me. I'm currently the chair of the committee, so that I mail those same 3 questions out to you with the same advice. Don't overthink it, just answer the question. And then when I have that, I will then, if I'm doing the pairing, I will look at your answers and I will look at my list of mentors and say, okay, where might there be some connections here, either in academic background or in interests, anything where there might be just a little bit of a connection, a possible connection between the 2 of you. Then I will send you a list of 2 or 3 names and give you what their answers were to the questions you answered. And then you look at those and think, okay, I think, you know, this person would be a better match than the other. Send that to me. That comes back to me. And then I contact the mentor to say, you know, can you take on a mentee right now? Most of the time the answer is yes. Occasionally people are just kind of up to here and are not, can't, but we work with that. So once you've made your choice and the mentor has agreed, then what I simply do is put you in contact with each other, letting you contact each other by way of email, and then it's up to you. The initial meeting between the mentor and the mentee is usually, I recommend using the Luce Center where the Emeritus College is located. A couple of reasons. Parking's free. It's on the edge of campus. A private office is available for conversations in its neutral territory. So if you don't want everybody to know you're thinking about retirement, you can easily go and talk to a mentor while you sort through this idea in your head. Nobody needs to know, because these are confidential sessions. After the initial session, then it's up to you and your mentor to decide when and where the next meeting would be. Generally, there are not more than 3 meetings. Sometimes 2 does it. Occasionally, there may be a need for a 4th meeting. Our goal is to help you consider retirement, to come to understand that it can be satisfying and allows opportunities not available for full-time workers. Right now, we have 13 active trained mentors, and we have mentored 52 pre-retirement faculty. And insofar as I know, everybody's been pretty happy with the process. So in conclusion, let me repeat a point I made earlier. Having a one-on-one confidential conversation with a peer who has been through the process of taking the leap from the known to the unknown and who enjoys being retired can help retirement eligible faculty to realize that there can be a satisfying life after retirement.
Well, thank you, Helen. And if there are questions, if questions come up, Helen's going to be around, so feel free to raise your hand later. There's one question that came in on chat asking about whether catastrophic drug coverage is available if you were hired after 2003. And so I don't know of insurance brokers who had offered that catastrophic drug coverage. There may be some, and I just don't know about that. But if you were hired after 2003, it's not provided as part of Emory's function, and so I don't know if it is. And if you know Jim or anything, you can feel free to jump in. But I imagine one can get coverage for almost anything, but I don't know of any standard places to look for that. Yeah, were you going to say something, Jim?
No. The only thing I want to say to all the people that are out there is that they owe a great debt of gratitude to Gray. If you look at his health information and his extensive coverage of the health care, you probably won't have any questions because he has been most thorough and he has been a wonderful person in collating all of that information. So I just want to say a here to Gray for all his wonderful work in this area and all the other areas of the Emeritus College.
Well, thank you, Jim. But Jim is really the person who got everything started, and so he was the foundation on which everything has been built, and so he certainly deserves a lot of the credit. Now, are there others of our members who want to say anything else about other functions of the Emeritus College before we end the seminar? Just raise your hand and I'll recognize you if any of you want to say anything. Gretchen.
I'm still muted, I think.
No, you're.
Oh, no, I'm not. Okay, all right. First, just so to judge what I should say here, are we wrapping up at 5 o'clock? So should I keep this to just 3-4 minutes? I think Ron might like to say something too.
Well, we don't have to end at 5, but I think we want to be.
But yes, okay. Okay, well, I can say what I want to say briefly, which just reinforces what Helen was just saying and what we'd all say if we had a chance, I think, which is that, yes, there is life after retirement. You might even find it more wonderful in many ways than life before retirement. Is there a thing right in front of my face? Let's see, I'm moving that. Anyway, yeah, you don't need to disappear into the void. As John Buga always said, and he was so right, that this is a view of retirement that makes it part of your lifetime arc as a faculty member. It's just moving into a different phase of your life. As the person you've always been, you can continue to be who you've been, and you can add on to who you've been, because you do have time, for one thing, as Helen was suggesting, to do so many things you just didn't have time for before, including more of what you've always done, more teaching, more research. If you like collaborative committee work, you can avoid the kind of committee work you've always hated and sign on for committee work you would see as still productive here at the university or in national and international organizations. But what I really wanted to emphasize is The Emeritus College programming that I've been involved in now since I retired 9 years, and I've been primarily involved in scheduling speakers that we have had at lunchtime every 2 weeks. Now, with things the way they are, we've gone to Zoom meetings, and in fact, we're having weekly sessions and sometimes bi-weekly sessions. Anyone has always been welcome to sign up for these sessions. Our meeting room, our actual meeting room in the Luce Center, has a capacity of 60. We've had many more than that sign up for the Zoom sessions we've been doing. And again, any of you are welcome to check into these. If you just go to our Emeritus College website, you'll see we've got just all kinds of wonderful speakers lined up. We just had a super program, Henry Kahn speaking on Monday about the cost of medical care in this country. We've got a couple of programs on coronavirus, aspects of coronavirus coming up. We've got Denise Rayner this coming Monday talking about experience of African Americans in medicine. Great programming. Gary Hawk is doing a special commencement day presentation for us. Brenda Bynum is reviving her wonderful program on Flannery O'Connor. So go to the site, and even in Zoom fashion, what we're doing right now, but when we're able to literally be together, these programs, just a sample of the programs we offer, great opportunity for a kind of intellectual camaraderie with faculty from across the disciplines. You know, most of us have been here at Emory 30, 40, sometimes 50 years and not crossed paths, you know, much less really had cross-disciplinary conversations. And in these programs, there's so much opportunity for discussion, for really getting to know people from many different disciplines. You know, forming friendships. I thought I was full up on friends. I didn't feel like I needed any more, but I've made so many more. And again, to add to the kind of physical health we hope to maintain, kind of intellectual, emotional, spiritual health that can come from this kind of camaraderie that our programming provides. So I just wanted to mention that and encourage you all, whether you're retired or thinking about retirement or not, to look at the website and go ahead and sign on for these Zoom programs and see what it's all about. It's pretty good, gotta tell you.
Okay, thank you, Gretchen. And Ron has a comment.
Well, let me just reinforce some of the things Gretchen said. When I was thinking about retirement, one of the aspects, well, the major aspect was how do I maintain my intellectual sharpness? And being a mathematician, that's easy. I can do math any place, anytime. And I'm still doing research. But there's other aspects that I was interested in. And these lunch colloquiums that we've had have been fantastic. People from all kinds of different disciplines have gotten my interest over and over again. I try to make sure I get to everyone I possibly can. And as Gretchen said, one of the other things I thought about was, you know, how do I maintain contact with some of the friends I've made over the years? And that's, the Emeritus College has allowed me to do that, plus make some new friends. So it's really been a great experience for me.
Great. Thanks, Ron. Any other questions or comments that anyone has, either from our members or from those of you who would like to ask any questions about retirement or the Emeritus College? Well, if not, I want to thank you for coming, and feel free to email me with any questions that you have that have come up. And I wish you all the very best in these next few months, which are going to be probably challenging times for all of us. So thank you very much.